What is up, guys? This is Dr. Madigan checking in. Just wanted to let you guys know a little bit about me before starting with this video. I've been a physical therapist for 6 years now. I've worked with all sorts of athletes ranging from 10 to 12-year-olds to NFL pros. So, I'm going to try and come out with a video every week about a certain play or certain injury that happened. So if you guys would be pleased to like this video and subscribe to this channel. Videos should come out every Monday. With that, let's get started. So this week we're going to take a dive into Kristaps Porzingis' injury. I am a huge Mavericks fan, and so of course I have been following up with this injury ever since he had to sit out the rest of the Clippers series. So apparently he got hurt in game 1. I wasn't sure exactly which play it was. He tried to play game 2, and I think he sat out the rest of the series after that. And after that, after the series was over, news was kind of dead on what happened to his knee. Only after a couple of weeks did they say he had a meniscus tear. So everybody was real, up in the air. Was he going to have surgery? Was he not going to have surgery? Again, we got nothing. The Mavs kept it pretty tight to their chest for a little bit, and then news broke, I think about a week or so ago, that he had surgery to repair his meniscus. So there are actually 2 types of surgeries. One of them is just a little easy cleanup of the knee. Arthroscopically, they go in there and just shave out whatever part of the meniscus is torn. And then the second surgery is a repair, where they actually go in there, they stitch up the meniscus. And so with what I've seen pop up in terms of KP and this picture here, he is in a brace, crutches, so that tells me he had a repair. So there are advantages, disadvantages of having this surgery. Really, there is only one disadvantage, and that it takes a longer time to recover. If you were to have the meniscectomy, which is where they go out and cut out part of the meniscus, he could have been back as early as 4 to 6 weeks with rehab. But with this surgery, he's going to be non-weight bearing for a little bit, and his return to sport, on average, I've seen people come back 5, 6, 7 months after the surgery. The only reason there's a big difference is in this surgery, they actually repaired something. They stitched it down. You gotta wait for everything to heal up, and then you have to slowly progress back to weight bearing, back to strengthening, back to sport-specific activities. And so the good thing about this is the doctors, one, they found that the tear in the meniscus was in an area that they could save. Sometimes the meniscus will tear in an area where doctors know that there's no blood flow to that area. It's never going to actually heal up. So it's good to prevent further deterioration of his knee in terms of early onset arthritis, and just other things going on in the knee. And as most of you guys know, the dude is 7'3", and of course his ACL rehab took a heck of a lot longer than a normal one did. But I also think that's because his camp and his doctors were really conservative about it. So I would actually imagine that they're going to be a little bit more careful again with this injury. And obviously we don't know when the new NBA season is going to kick up. So I don't know. Early reports are that he'll be ready for training camp, but I don't even know when training camp is. So so just keep a lookout. KP will be back. I think he'll be fine. He's a tall guy, and with tall people, it kind of changes all the physics of the body, and how everything recovers, things like that. You guys may be asking why they took so long to go ahead and have the surgery. Well, because they probably saw in an MRI that the tear was in a very healable area of the meniscus. They probably wanted to do conservative rehab, and so KP was just rehabbing his knee, seeing if they could do it conservatively. So I'm assuming that he got back to workouts and stuff like that, shooting around, doing some drills, but the fact of the matter was they probably could never get either the pain or the swelling or just the general feeling of uncomfortableness out of his knee, and so they opted to have surgery, and so yes, here we are. So again, just a quick rehash of his injury. If you guys want more information, just feel free to leave some comments down below. Feel free to DM me on Twitter. It's @__Matt Wins, MATTWIN. Yeah, thanks for the watch, guys. Enjoy your days.